In 1981, Tom Riddle and I became partners in an ambulatory practice in Lexington.
From the beginning, we talked about building something.
We kind of grew into the practice. We started with 3 buildings on 24 acres with a lot of dreams. Currently, we have about 275 employees, of which 52 are veterinarians, 17 interns, 10 to 11,000 horses a year admitted into the hospital.
We have surgery with 5 boarded surgeons. We have internal medicine with 5 boarded internists. We have podiatry, and we have ambulatory with a total staff of 22.
I am surprised at the growth and how blessed we have been in practice. It's been a gift to build a practice like this, and primarily it's because of the people we've hired.
Each of us has an area where we concentrate. My area would be orthopedic surgery. We do orthopedic surgery from the most sophisticated long bone repairs that are capable in horses right now, through the routine arthroscopies to routine periosteal strippings and leg straightening procedures. This horse has a fracture. That piece that is in the middle of the screen is from the edge of his sesamoid bone. We will do 4,000 general anesthesias every year. That would be for surgical procedures. The reason you might want to come here is because we've done more fetlock arthrodesis, or the fusion procedure for horses' ankles, than probably anybody in the world.
We get cases that are the hardest of the hardest. The extreme cases and the cases that require dramatic intervention, implants, screws and plates, things of that nature. Our major problem was this angle to the fetlock, and what we've done with the repair is we remove the cartilage from here to make this one bone, and then we place screws in to set the joint essentially in a normal posture. Someone was working on a Missouri Foxtrotter the other day. You name it. All of us like to work on all breeds. We're equal opportunity veterinarians. It doesn't matter who the horse is when you're working on them. You work just as hard on old Pokey as you do on an expensive yearling or expensive racehorse.
The anesthesia department here at Rood & Riddle, we have 5 veterinarians on staff at all time. Each case gets unique care. We're capable of anesthetizing a 2,900-pound draft horse down to a 20-pound miniature foal. We make sure that we are monitoring every aspect of the horse to make sure they have good blood pressure, normal ECG, normal cardiac rhythm. And then when we get them into the recovery stall, we have trained recovery people that actually make sure the horse doesn't get up until it's time for it to get up.
The cases that come into our neonatal intensive care unit are cases of newborn foals that had problems during birth or maybe shortly thereafter birth. Oftentimes these foals are really compromised, unable to stand, unable to nurse. Sometimes they're in shock, and our job is to revive them, treat them, and stabilize them so that then they could go back to the farm.
This one was just born this morning about 9 by a dystocia, yeah. So she hasn't stood yet.
They get round-the-clock treatment, 24/7. We can do everything in the neonatal intensive care unit. Blood transfusions, plasma transfusions, intravenous nutrients if need be, oxygen care, ventilator support if the foal needs help with breathing. We do it all.
When people think about equine urology, they think about Steve Reed. He has become the urology specialist for the world.
Right now we're doing a myelogram. It's got some neurologic gait deficits. The horse is still not right. Clumsy, gets very, very weak, especially when the rider's going downhill. Maybe it could be something pinching the spinal cord, and so as a consequence, what we're doing now is we're going to do a myelogram. So we'll be able to identify whether or not there is compression. And the way we're going to do that is to put contrast in there, shoot some radiographs, and we'll shoot them in 3 positions. Put that under nose. And on this particular horse, we can see that there's good contrast all the way back, even into the thoracic vertebral region. When we did it in the flexed position, however, you can see that we lose the dorsal contrast and we lose that ventral dicolumn as well, indicating we have pinching between the 4th and 5th cervical vertebrae.
The Root and Riddle Podiatry Center is designed to handle all the hoof care needs of all the patients. We handle everything from just chronic low-grade lamenesses in the foot to some very serious hoof injuries, laminitis, foot infections, and hoof wall injuries. Any kind of foot disease you can think of, we're designed and equipped to handle. We have 4 full-time veterinarians and 5 full-time farriers doing all podiatry. We also video a lot of our horses, especially horses that interfere or have balance problems. A lot of our staff is very motivated, very compassionate, very driven, always trying to think, what's best for the horse, how can I make this horse happy, how to make this client happy, and get this horse back doing its job again.
Our ambulatory practice has grown dramatically. We now do a lot of sport horse and show horse practice.
Good.
We have a large sales practice at Root and Riddle, and we literally are with the clients who are selling from the day the foal is born until it enters the sale ring, and trying to do everything possible to produce the very best product for the sale. I spend my day going from breeding farm to breeding farm, examining mares, determining when to breed them, determining if they have a problem that we need to correct prior to breeding, and then checking them for pregnancy.
This is an interesting stage of gestation to ultrasound. This is the fetus's head right here. This is abdomen. Just there in the center of the screen you can see the heart beating.
In addition to our large breeding farm practice, we also have reproductive specialists who work with farm owners in the diagnosis and treatment of infertility in both mares and stallions. These reproductive specialists also work with non-thoroughbred breeds with advanced reproductive techniques such as embryo transfer, semen cooling, and semen freezing.
Here at Root and Riddle, our treadmill would be considered to be on the cutting edge. We're able to acquire video endoscopic images of the upper airway while traveling at high speed. Most of the horses that we put on the treadmill have a history of making upper airway noise or having poor performance problems, but we can also do cardiac evaluations as well.
Nuclear scintigraphy has been available for many years, all species of course, but it's widely used in horses to diagnose early fracture. This is a nuclear scintigraphy, or what's called a bone scan. We can see a lot of radioisotope uptake, which is what we call hot spots. We have evidence of a stress fracture.
Digital radiography uses a computer to remove the sort of background fog. It gives you sharper images because it enhances all the edges of the radiographs. So when you enhance edges, it's easier to see fractures. It's easier to see bone change. Ultrasound examinations are a tried and true area of examination of soft tissues, tendons, ligaments, things that you can't x-ray.
The best diagnostic tool we will have is MRI. Here at Root and Riddle, we have a high field scanner. There are probably less than a half a dozen high field magnets in the country. The MRI will show us both bone and soft tissue to a detail that we've never seen before. We'll find things that we didn't know existed.
The white is actually joint fluid. One of the big things that we're looking for is fluid within a certain structure or bone, primarily, that doesn't belong there. That tells us that that is a source of inflammation and likely a source of lameness for the horse.
In 2007, Root and Riddle did open Root and Riddle Veterinary Pharmacy. A major emphasis of our pharmacy is the compounding or the preparation of medications for horses that are not commercially available. And we're very fortunate to have a staff of outstanding pharmacists who are very, very skilled at the preparation of these medications. It's always nice to get into new things and provide more services for your clients.
We have assembled an awesome team of veterinarians here.
I would hope that people would look to us for the newest and the best treatments.
Very proud of the work we do.
Everybody works together as a team.
Keeping the excellence is really a paramount part of our job. Our motto is what's best for the horse.
Every horse is treated the same. We treat them like they're a superstar.
Our clients mean so much to us. We appreciate the opportunity to work on their horses.
Tom Riddle and I have always had the same vision, to be the very best we can be, to build the practice to what it is today, to build the hospital facility and to hire the people that we have. It always comes back to the horse. If we take care of the horse will take care of us.